Hello, I'm Lisa, and this is Mandy, and we're here with Specialty Wellness located in the Colony. And today we're going to talk about our in-office liposuction.
So yeah, kind of tell us the biggest difference. I feel like there's so many myths out there. The biggest difference between your traditional liposuction and the laser-assisted liposuction that we do here in the clinic.
So we do in-office liposuction, also known as awake lipo, which means the patient is awake. We do give them a couple of medicines if they want to help kind of calm them, relax them. But from our experience, I mean,
they love it, honestly.
Yeah.
You would think that it would be like super painful or uncomfortable, but patients get in there, they have a little bit of medicine in the morning, and then they're on their phones, they're playing games, they're listening to music, they're chatting away with us, which is awesome. It's definitely much more painless than you would think.
Yeah, a lot of people are scared. Oh my gosh, I'm awake. Is this going to be painful? Honestly, it's not. We numb the area that we're treating with lidocaine mixture. It's called tumescent lidocaine. It's basically saline and lidocaine that we just kind of numb the whole area that we're working with. So the patient honestly doesn't feel anything after a few seconds of that numbing medicine going in the tissue.
And can you tell us kind of like about the recovery time for this procedure?
So since this is you're awake, the procedure itself is much more gentle than traditional liposuction. I'm sure a lot of you have seen those videos of just kind of the plastic surgeon going in there with that liposuction cannula, getting as much fat as possible, which is awesome and great. But that can be a little bit more traumatic for the body. So we actually use a very, very skinny, tiny liposuction cannula. It's so small, which means it's very gentle on the body, less bruising, less swelling, less downtime, less pain afterwards. I mean, most patients do it on a Thursday or Friday, and then they're good to go to work on Monday. So a lot of less downtime, less pain, less swelling, and then kind of quicker results because your body's not having to recover from a big surgical procedure. So liposuction is when we make a tiny incision and we put this cannula inside the treatment area and we actually suck out the fat with this little cannula that has a vacuum attached to it. So we're removing fat from areas that have too much volume or those stubborn areas. Sometimes people diet and exercise and they live a healthy life, but they have those stubborn pockets of fat that don't go away or they're resistant. So liposuction is honestly the perfect treatment to kind of get those little stubborn fat pockets out. So this is our waste particle. So, we always try to get as much fat safely and as effectively as possible. But this will basically calculate how much fat we've taken out during our procedure.
And it also, the machine that we're using has the laser also tightens the skin. And so some people are worried, okay, if I'm losing this like big chunk of like fat, then my skin's going to be really loose. The nice thing with this laser is that it's helping to tighten that skin over time. And so you'll get your full results after 1 year.
And we also have other skin tightening treatments in case patients do need additional skin tightening treatments after their liposuction. We like to start those at about a month after the liposuction has been performed, just so we can kind of see the results, see where their skin and treatment area is at. And then we usually recommend doing either the CO2 laser for skin tightening or the radiofrequency microneedling, a series of those for the skin tightening treatments. So areas where you can get liposuction, double chin is really popular, the back of the arms, of course, the full abdomen, love handles, the back fat, inner thighs, outer thighs, knee fat even, basically anywhere that you can like pinch that stubborn fat, we can suck it out. Downtime for liposuction, usually for a whole month, we tell the patients to wear a compression garment just because that skin, fat, and then muscle layer is there and we remove the fat. So we really want the skin to kind of heal as tight as possible naturally on its own. So we have them wear a nice compression garment to kind of hold them all in so that that tissue rebinds to that layer that's been removed. And then usually we say don't do any harsh like exercising. They can walk, they can, maybe do like a light bicycle ride, but nothing really where they're going to be using their core muscles just because we want them to rest and we want them to heal correctly and on time. And anything that's overexerting for the patient can just delay their healing and cause unnecessary pain. But usually at a month, patients are good to go and they have no restrictions. They can do whatever exercise workout they are wanting to do to just prolong their results.
Okay, so once you have all this fat in here, then what do you do with it?
So we can either throw it away, or if a patient would like, we can actually re-inject their fat into areas where they're wanting volume. So it's called fat transfer. So fat transfer can be in your face for the hollowing that occurs with aging. We can do a fat transfer to the breast to help with any asymmetry or to just give the patient a little bit more volume. Hip dips is another common kind of area for fat transfer for those patients who kind of want more of like a hourglass, round body, or we can actually put the fat in the buttocks area to kind of give a little bit more volume and help lift the buttocks and give more shape. In-office liposuction takes anywhere between 4 to 6 hours, just kind of depending on what the patient is treating and how quickly the procedure is going. But again, a lot of patients just kind of love hanging out with us. They're relaxing, they're sleeping, they're chatting. I even had a patient like buy a home or talk to a real estate agent on the so it's honestly a really comfortable procedure, and we just love spending the day with that patient.
If you're ready to book your consultation for liposuction, then comment below, message us, call us, let us know that you saw this video, and you can get 20% off of that procedure.
All right, and I'm Lisa, and this is Mandy, and we're with Specialty Wellness in the Colony.
Bye, beauties.